All right, welcome everybody. Is it near you notice a sort of a narrative building in the mainstream media about this administration? That's the administration of tough love or tough luck, regardless of your point of view here, that they've got a tougher health care policy, much tougher than Barack Obama's, and a tougher policy when it comes to housing aid and any sort of aid here. There's a new sheriff in town, and at HUD, he's a different kind of sheriff of that, a trained neurosurgeon. Of course, I'm talking about the former presidential candidate, now runs HUD, Dr. Ben Carson. Secretary, very good to have you. Thanks for coming.
Thank you, Neil.
You know, it comes at a time, and I was looking forward to have you, sir, because all of this is coming together at the same time. You've been looking about the state of poverty. You got into some heat not too long ago talking about a state of mind. I knew what you were saying, but this idea that you didn't want to make housing or public housing too comfortable to give people a way to aspire to something bigger. You got a lot of heat for that. And then lo and behold, Republicans debating a measure that will call for curtailing the growth of Medicaid, and they're lampooned for sort of being too mean and too mean-spirited. So there is a theme to this, and that is outrage that someone would dare come forward and say the government can't be the answer to all your problems. What do you think of that and the heat you take, the administration by extension has taken for holding to that view?
Well, I think it's important that we recognize that, you know, we're a nation that's $20 trillion in debt. And, you know, we can give out the candy today and then say to the people coming behind us, too bad, I'm sorry we used it all up. Or we can be responsible at this point in time. You look at all the other pinnacle nations that preceded us that were totally irresponsible, and look what happened to them. We can learn from their mistakes. So, you know, it's not so much a matter of being stingy. It's a matter of being responsible. And, you know, we've already seen in HUD that, you know, running things in a more business-like manner saves us enormous amounts of money. You look at continuum of care programs like permanent supportive housing for the homeless. We're finding a lot of savings there already. And, you know, it's not that I don't believe in being compassionate. There's some saying, you know, housing first. That's the only thing you should be thinking about. But I say housing first, second, and third. That means we take the homeless and we put them in a shelter, number one. Number two, we diagnose why they're there. And number three, we fix it. You know, that's what's being really compassionate. And over the long run, that's the kind of thing that saves us an enormous amount of money.
You know, you got a lot of guff when you were looking, I think, at a public housing project and noticed that it looked pretty nice, almost too nice. Your argument was you don't want to make this too cushy where you never have the aspiration to leave or get out. I think that's what you were saying, but it was interpreted quite differently. What did you think of that?
Well, actually, you know, there was a Times reporter in there with us, and I think maybe totally misunderstood what was going on. There were two different settings. One of the settings was a place where we rapidly got people off the street who had lost their housing. And they were concentrating on making it, you know, clean and comfortable, but not making it cushy. Instead, they used their money to concentrate on getting people into a point of stability and back into a permanent type of housing solution. That's what I was praising. And then in the other case, it was a Veterans Administration housing facility for homeless. I said, this is wonderful, this is beautiful. The only thing that's missing is a pool table. And I said, this is what we should be doing for our veterans. They turned it around and say, Carson's saying that this is too nice for veterans. Just a bunch of crap. Yeah, but, you know, I'm so used to that.
But, you know, you did observe not too long ago, Doctor, that about 3 to 4 times as many people are in need of affordable housing than we're able to provide. Now, given the fact that you want to put a limit on what the government can and will do, I think incumbent upon that observation was more people getting jobs, more people getting better paying jobs. But therein lies the rub. A lot of the jobs we have seen gained over the last decade, well, you welcome them back, they're at a fraction of the pay as before. So how do you change that model?
Well, that's correct, but you're already seeing that starting to change. You're already starting to see wages going up. That's only going to continue as we begin to create a more friendly environment you know, for manufacturing in this country, and bringing jobs back from overseas with the tax policies, these things will take care of themselves very effectively. And, you know, there's a whole host of things that can be done with public-private partnerships, which will create housing much faster than it has been in the past. So these are the kinds of things that we're looking at, creative ways of not only putting people in houses, but also of fixing the communities and creating an environment where people can thrive. We're looking at health care in low-income communities so that people don't have to go to the emergency room where it costs 5 times more, and where you have that continuum of care so that you don't have all these stage 4 diseases. These are the things that save us enormous amounts of money. And that's what we have to look at, efficiency. Run it just like you do your house.
You know, I know you're the housing secretary, but I'd be remiss also, given your medical background. I mean, you're a pioneering neurosurgeon. So when you hear the health plans that are being debated, Rand Paul was up at the White House today talking to President Trump, but that Senate measure is very, very pricey. It's been scored so much so that 22 million fewer Americans than would have been the case if we kept Obamacare intact are going to have health insurance 10 years. There's no way to prove that. It's the best figure we have, though. Do you think the government should still have a role, though, in health care? Because a lot of conservative critics of the Senate plan is that you still have the government, albeit on a slightly less basis, controlling health care. How do you feel about that?
Well, the government is supposed to facilitate life. That has to do with health care. The pursuit of happiness, liberty. I think all of those are important things. So there is a role, but it's not a predominant role. It's a facilitating role. And I think the senators, as they look at this, they will come to recognize that this is much more facilitative of life, liberty, and a pursuit of happiness than what we had before.
Much more? Because a lot of people say maybe a little more, but maybe not much more.
No, it's a lot more. And it's also not the final script. You know, this is a very, very good start. A lot of things have been looked at. And I think, you know, it's going to be tweaked. I would invite the Democrats to get involved in helping to tweak it, too. You know, this is something for all of us. We need to get out of this idea of scoring political points and think about what the responsibility is of the representatives of the people.